I'm Dr. Dubay,
And I'm Dr. Cody Grigsby.
and we're going to show you today how to help yourself if you have an intercostal neuritis.
And if you've had this, it's a very painful condition, usually just affecting one side.
It's an horizontal pain that cuts your breathing out.
And it makes it really, really tough to do deep breathing.
It's very shallow breathing, and usually you have an intalgia slightly bent forward.
If you lean into it, that's a quick way to find out if that is caused by that. So it could be a lung problem.
Any motion of rotation is extremely painful. So in summary, if you have a one-sided side of pain, horizontal, that prevents you from breathing deep, that hurts you tremendously, that's even more painful on rotation, then usually it's an intercostal neuritis. Now, this is it's on the right side, it's okay, but if it's on the left side, we got a problem with the heart. So
if you think it's a problem with your heart, you need to call 911 to see your cardiologist. I know it can be expensive to go to the hospital.
yeah, but it's better to pay the hospital than the mortician.
That's
correct?
the truth.
All right. So
Now,
if you have a problem, Dr. Cardi, on the left side, right away, you don't mess around with that. You call the hospital, you go to the hospital. We don't fool around with that. Now, if you have a problem on the right side and you want to differentiate that from a lung problem, you have the system that you explained of flexion, where you bend toward the pain. If you have more pain as you bend toward the pain when you're resting, usually it's an intercostal neuralgia. If you don't have that same pain but less pain, it may be a lung problem. Same thing, you call your physician.
that's right. What's happened, doctor, at the end?
By doing something stupid, you moron.
Come on.
All right, how does that happen? You have to understand the mechanism behind it, okay? And anybody can do it, even if you're not a moron. So the ribs has an interior movement and upward movement. So the spine is fixed and the rib is going to move interior and upward as you breathe in. So if you block that motion, when the rib tries to expand interior and up, if you block that motion, basically the whole rib will be shifted on its insertion on the posterior part. And close to its insertion, you have small nerve, among them the intercostal nerve that run between two ribs, and you have a very, very sharp pain. Daily life can create that. One of them is using tablets for kids, working on the computer, gaming. For women, the type of clothing, if you big-breasted and you wear a bra with a wire, the wire creates an inflection at the level of the fourth rib. And basically, if you do have that, you will have probably to stop wearing that type of bra at home for a few weeks. And if you go out, use a sport bra that flattens you a little bit, but avoid that type of problem. Are we clear on that, Dr.
Very clean, yes. And then there's some exercises and physical movements that you can do to really help you relieve this pain. And we're about to show you that now. All right, so now let's say you do have intercostal neuralgia. What can you do at home? We're going to start with something by yourself, and then if you have a partner.
All right, so you're the patient, Dr.
I am the patient.
Very, very simple. Everything is going to be on breathing. So we're going to put towel, 4-day towel, in the middle of the kyphosis at the level of the hump of your mid-back. The patient is going to be lying in his back. We're going to have straight legs. It's better with straight legs. And we're going to open his arm wide. And you can put your hand like that, wide, to open the chest at the maximum.
Now, it's better to have a hard surface. Do not do this in your bed. You need to have firm support right there where you put the towel.
So a yoga mat on the floor, a hard carpet, fine, not a bed. Now, I'm going to ask you, Dr. Cody, to breathe in and out. So he's going to try to breathe normally initially to not hyperventilate. And progressively, around 25 breathing cycle, he's going to try to increase the depth of his breathing. And sometimes wiggling a little bit the arm to unstuck that those ribs which are stuck works. You can improve that exercise on your own by putting a little weight right here. So I'm going to replace, you could put 2 bottles, example, 2 water bottle, and you put, as you breathe in, you put a little pressure and relax as you breathe out. So you drop your hand on the floor and then raise your hand a little bit with a little bottle, breathe in, and drop it on the floor. Raise your hand and drop it on the floor. And that motion usually will be quite helpful as you by yourself dealing with an intercostal neuritis. Now, if you have a partner or a spouse, you can ask him to help you and maximize that traction that you want to put on the rib. So you're going to ask him to grab your forearm, and now on inspiration, you're going to follow the breathing of the patient. As he breathes in, you're going to pull on both arms, relax. And then you're going to pull a little bit, the next inspiration at the side, painful side. Relax. And then you alternate with the other side. And this protocol is going to be repeated around 25 times, roughly. And it's enough, usually, to alleviate quite a bit that intercostal neuritis and allow you to be much more functional. You can do that several times a day. Those conditions are extremely painful, highly recurrent, and usually by doing that, basically it's tremendous help when you have nothing else.